Hello, everybody, and welcome to the MMY podcast brought to you by the Institute of Clinical Excellence. My name is Annoushka Ranaraja, and I'm a doctor of physical therapy and a member of the Older Adult Division of the Institute of Clinical Excellence. Today, we're going to discuss a case that highlights how interconnected our body systems truly are. We often think of chronic kidney disease or CKD as a story of filters and fluids, but today's case study reminds us that kidneys are also the silent architects of our skeletal system. For privacy reasons, we will call the patient Sydney. Sydney is a 68-year-old female that I've been treating for low back pain with sciatica and general weakness. I came to work on Monday after treating this patient on Thursday, and Sydney told me that she heard a pop after standing up from sitting, playing cards for 3 hours, and had so much pain that she had to be rushed to the ER. She didn't fall down a flight of stairs. She didn't trip. She just stood up quickly from a chair, and yet she couldn't walk without intense pain. Imaging revealed 2 non-displaced fractures of the pubic rami, a broken pelvis. So she's telling me the story, and I'm thinking, there's no way this lady fractured her pelvis by standing up. So what happened? What did I miss? So instead of just sitting there and going with it, I had to do research because I'm like, I missed something clearly. But in my search, I found this article, Osteoporosis in Patients with Chronic Kidney Disease, a Systematic Review. So I'll link that in the comments. But with this review, it stated that most people think of kidney disease as a plumbing issue, so the body failing to filter waste. But this study actually says that CKD is a structural issue. It's a silent thief that doesn't just target the kidneys, it goes after the very foundation of the body. The authors suggest that for patients with CKD, developing osteoporosis just isn't a risk, it's almost inevitable. The core problem to understand here is why the bone breaks down. So the review breaks down the vicious cycle between the kidney and bones. When the kidneys start to fail, it stops doing 2 critical jobs. One is the vitamin D glitch. The kidneys can no longer activate vitamin D. And then without that active vitamin D, the body can't absorb calcium from food. And then the other thing is the phosphorus trap. So failing kidneys can't flush out excess phosphorus. High phosphorus levels scare the body into thinking it's low on calcium, which then cues the hormonal hijack. To compensate for this perceived calcium shortage, the body flips an emergency switch and triggers secondary hyperparathyroidism. The parathyroid glands go into overdrive, pumping out hormones that tell the body, we need calcium now, go get it from the bones. I know, a lot of physiology review. So essentially, the body starts cannibalizing its own skeleton to keep blood calcium levels steady. Sydney didn't just have osteoporosis, which is the age-related thinning of bone. She had renal osteodystrophy, a specific type of bone disease where the architecture of the bone becomes porous and weak due to kidney failure. So the clinical reality of this, it's not just an old age thing. The study emphasizes that CKD-related bone loss is distinct from typical age-related osteoporosis. It's faster, more aggressive, and harder to treat. So the one issue is at the fracture risk. People with CKD have significantly higher fracture rates, which leads to massive drop in quality of life and higher mortality rates. And then the other thing is the diagnosis gap. So standard DEXA scans, which are the gold standard for bone density, might not always tell the whole story for someone with CKD because the quality of the bone is changing, not just the density. So things that we can do as clinicians are make sure our patient is following up with an endocrinologist as soon as they have the CKD diagnosis. Maybe making a referral to CKD-informed dietitian that will help them understand what foods they should be eating. And then staying informed of their DEXA scan results, because that might give us better insight into what we need to be working on strengthening with these patients. If you're getting the people with a CKD diagnosis, getting in early and working on improving bone mineral density, assuming that they have diet on board, giving them exercises that will allow for impact, not just resistance training, but actually getting good impact. Sydney was doing strength training with me. We hadn't missed that component, but we were not doing impact training, more so because we were avoiding it from pain. We were just trying to get her upright and walking with her walker. But it was very insightful to know that I should be approaching a little bit more with these patients to help them. She also hadn't had an osteoporosis diagnosis prior to this. So we made sure she's seen the endocrinologist. She's had a DEXA scan since, she's had multiple x-rays since, partially because of the fracture. But as soon as she is fully healed from this fracture, we will be adding in more impact work for her. We've just started being able to add in that resistance training. So there's really helpful tidbits for us to know. If you need more ideas for osteoporosis, we have tons of videos throughout. We have information in our courses, especially like level 2, we have a specific week for osteoporosis, and then we go over a whole lab of it in live, especially. So different ways to approach that, but just knowing that information, like I wish I had that information sooner so I could have been implementing it because I knew she had CKD. But, you live and you learn, and I get to share this information with you so that you don't make those same mistakes that I did. But if you're a clinician or a patient, the message is clear. Don't wait for a fracture to start worrying about bone health. Bone management needs to start the moment a CKD diagnosis is made. It's a really important balance of involving diet, supplements, vitamins, and constantly monitoring the parathyroid. Make sure that your patient is seeing an endocrinologist, a CKD-informed dietitian, and staying informed on their DEXA results. If you're interested in learning more and having ideas on how to manage complex patients, join us for live or online course, which you can find on ptinice.com. Also, click the link below if you want to stay up to date on all things geriatrics in less than 3 minutes. We have our MMY Digest email that goes out bi-weekly. But if not, I hope you enjoyed this episode and thank you for joining me today. Bye.